When I was overweight, it was just hard to get motivated and to go out to the store, to just get up and take a shower and go to work. I just wasn't happy, and
I was exhausted, and the weight I was carrying every day was just exhausting me.
Being diagnosed as the pre-diabetic and premenopausal at 36 years old was very frightening for me.
Obesity is a big health problem at present, in our populations, in our communities, and it's really affecting people's quality of life in a big way, more than most other common health problems or surgical problems. Because not only does it reduce one's longevity, but it also reduces one's quality of life.
Well, my son was hit by a car, and we had to go to the hospital for 3.5 weeks. And I could not climb the stairs. By the time I got up to the floor, my legs were swollen. It was just terrible. And I looked at him and I said, boy, I can't even be here for my own child.
It seemed to be my calling, because I felt like, I had this combination of compassion for the patient as well as the technical skills that are required.
There were so many things that I always wanted to do that I didn't have the confidence to do, whether it was, something athletic, for example, trying something adventurous and traveling even, and amusement parks and things that people take for granted, I often shied away from.
Before I had my procedure, life was very limited. I couldn't do a lot of the things that I wanted to do. I couldn't wear a lot of the things I wanted to wear. I didn't want to go places, and it's just very restricting living a life of obesity.
Finding someone to love you for you was my biggest challenge, because so many people in this world are cruel and they only care about what you look like.
When I started doing bariatric surgery laparoscopically, really changed the entire playing field, because now we could obtain the same results internally without a big incision, which meant no wound complications or much less wound complications, and a shorter hospital stay. With the evolvement of the technology that enables us to do these procedures with a degree of safety and precision that was unprecedented.
I decided to have the procedure when I have an appointment with my pulmonary doctor, and they told me that my sleep apnea was getting worse and I was stopping breathing every other minute, and that I couldn't really die from that. I talked to my kids about it, and I remember kissing them goodnight every night, because I really was scared that that would be the last time.
He never led me to believe that this was a quick fix. He always spoke about the procedure as a tool, as a mechanism for change, but always made it very clear that it was something that I was going to have to take full responsibility for.
We refer to bariatric surgery at present as bariatric and metabolic surgery, because it changes various metabolic parameters in the person. And this results in correction of a lot of health problems that these patients have, such as diabetes, which resolves in more than 85% of people after a bypass. Such as high blood pressure, which resolves in around the similar number of people. Same for things like sleep apnea.
My high blood pressure was really bad. I have headaches every day, every night. I couldn't sleep at night. Since I did the surgery, I haven't had one headache yet, not one time.
And every day I just am so happy to wake up. Nothing hurts anymore. I feel sexy, I feel confident.
Well, my family and friends, they feel like I'm really changing, not just physically, but mentally, and I'm happier, and they could see that, and it's inspiring them.
And my partnership with Mather Hospital has been over the last 10 years. And since 2007, we've been continuously a center of excellence. So it's been a privilege, and it's been a pleasure, and it's been a very interesting and very challenging as well as rewarding journey that we've had together.
My life changed in so many ways. Then now I'm able to do Zumba, kickboxing, ride bicycle, play tennis.
Being able to walk into a store and buy clothes Being able to walk into a movie theater and saying excuse me and not having to worry about someone talking under their breath about what you look like. Being accepted by the world is probably the most amazing feeling in the world now.
It has been a very, very successful partnership. It's been a partnership that's resulted in our becoming now one of the primary centers for bariatric surgery on Long Island. It requires a commitment not only from the surgeon, but from the entire hospital, including administration, nursing, and ancillary services, that we are maintaining the highest standards of care for the bariatric patient. You know, it has been such a rewarding journey for me. I really enjoy every bit of it. You know, I love doing the surgeries, but I love seeing the results. I really, and I'm so thankful that I can be part of the journeys of these patients.
I would like to thank Dr. Ahmad and the staff at Mather Hospital for giving me a great experience and a new outlook on life.
If I would have Dr. Ahmad in front of me, I will hug and kiss him again and say thank you again and remind him that he's my angel. He changed my life and I'm really grateful for that for the rest of my life.
My kids have the best mom that they could possibly have. My husband has the best wife that he could have. I feel like I am the best person that I could be. And what he gave me wasn't just physical, it was emotional, it was mental, and I will forever be grateful for what he's done for me.